This is a story that happened to me, and let me just give you like a tiny bit of it. Now, I used to work in a blood transfusion unit. We used to rotate. We have so many departments in our hospital, so you'll have to like go through all of them. Now, this particular time, I was in a blood transfusion unit, and what usually happens there is sometimes you have donors, you have replacement donors, we have voluntary donors, and we also have paid donors. So this particular day I was having replacement donors. So these are the donors that will come to replace the blood that will be used by either their friend or maybe their relative. You have a relative who is in the ward, maybe they've been admitted and they are going to undergo a certain procedure that will require blood. So what will end up happening is you are told your friends or maybe your relatives, you can tell them to come and donate the blood so that that blood will be used to replace the one that that person will use during the procedure. So they are called replacement donors. They are so common. So what happened this day was I receive a certain group. They've come to donate blood for one of their family members. And you see, before donation, you have to go through screenings. You have the first one where you are going to fill a questionnaire to give details about yourself, the condition, maybe in case you have something terminal, you have something that people usually lie, and I really hate that. And it's very unethical for you to lie during that, because you see, the blood that you are trying to give out will go and save, you are trying to save someone else out there, so you go to be as truthful as possible. Although we have other mechanisms that you can use to detect whether the blood will be safe. Now after that, then there will be another screening. We have several tests. Like one of them is HB. They get to test your HB so that you don't get to develop something like anemia after donating blood, or maybe you might faint during the procedure, because you remember you're donating blood, so part of a certain volume of you is going to go out of your body, so your body might be struggling maybe to, for example, give oxygen to your organs. So sometimes you might feel dizzy at the end of donation if the HB threshold is below. Now it comes to maybe your weight. You have several other things that are checked, and once you go through that procedure, then you are allowed to not donate blood. Now during the donation of blood, we have, now the whole procedure is done, then it comes to a point where now you have two vacutainers which are now drawn from either from the pint or from you, and that usually go directly to the lab. Now the blood that you have donated is usually separated. It's kept in a separate fridge of unscreened blood. Now after screening, and the blood is found to be fit for transfusion, then the blood is now moved from the unscreened to the screened fridge. Now this particular time, what used to happen here, and this is kind of a weakness that usually happen here, you might end up having one of the patient turning out to be HIV positive, and this was the case that happened here. It's a very interesting case. What happened this particular day is that patient, this is from how I understand from their point of view. During the mobilization, you might find it very hard to, for example, alienate one of the member. Let's say we have a group of like 10 people who are coming to donate blood. So during the mobilization, they say, hey, we are how many? We are 10. So you can just go and donate blood. Now to be kind of hard for you to like tell them, no, I'm not going to join you guys, because you see, my blood is unsuitable for donation, because I usually have HIV. So because of the stigma in the society, you cannot, they try as much as possible to conceal the fact that they are positive from either the members or their friends. Now, this usually leads to a situation like the one that I was in, whereby one of the patients, one of the friends, one of the donors was HIV positive. So they come, during, before you donate blood, there's no test for HIV. It is usually after donation, that's when we have other tests. These are a huge panel where you'll have to screen that blood before you declare that safe for transfusion. So that's where now HIV comes in. So after donation, we used to like take now the blood from the vacutainers to immunology, because that's where we used to do the screening for HIV, hepatitis, etc. We have a panel for that. So I take my blood samples there, take them there. Now, after now 5 hours, they are like, hey, Moses, I have some results here. You can just come and check them. So I go check them, and now the patient is positive for HIV. So responsibly, what you're supposed to do is to, first of all, make sure you inform the patient of their condition, because now this is now our patient. So I'm like, okay, so it's okay. Just I call the person and I'm like, hey, you came earlier today to donate blood, and I want to talk about something about your health in relation to your donation, etc. And they're like, okay, that was a very brutal way of approaching that situation, but they're like, yeah, I'm free. I can just pass by. Just give me 30 minutes. So in that minutes, they were there. And then I was like, after you donate your blood, this is what should happen. Blood will be taken, and like I explained to you earlier, will be taken to screening, because you have several tests that you have to screen for. But before I give you any information about what usually happen after maybe the screening, I want to take you through the counseling process, so that they get to tell you what to expect and what to do after getting maybe something that's not common. So I'm going to take you to the blood transfusion unit. There's like a section for counseling, so I take them there. We were on the way, and they're like, can I be honest? It's not necessary for me to just go there, because you see, I definitely know that I'm HIV positive, and definitely that will be a waste of time. For you to take me there will just be a huge waste of time. And I was like, God, you knew you are HIV positive, and you didn't actually tell me that you are HIV positive. You end up, okay. And they're like, no, you see, we have people in the society. We are all different. I'm HIV positive. This is timing out. So stigma in the society, I cannot actually afford to tell them that I'm positive, because if I do that, they are going to change the way they are going to treat me, and a lot of things will change. So I'm not willing to do that right now. So that's why I decided to just accompany them, because there was no way I could avoid that. So I decided to just come and donate, and praying to God that you pick that. And I'm so happy that you did, because now I don't know how I can live with that. I don't think, why would you not signal me? Oh, yeah, you're busy, and I think you had so many patients, so I couldn't find enough time. Plus, my friends and my family members were with me every time, so just sneaking out would have been something, I don't know. Now, I was left wondering, do we have like a gap there that usually is there a way? Is there, because even up to now I'm kind of confused. I thought about this situation the other day, and I'm like, how can we help these people? Is there a way that we can be able to help people in this condition? Okay, they don't want to like disclose their condition to the people around them. Is there a way we can be able to like avoid this, such that it will be easier for me to just not go ahead, and that it's a cost. You have a cost. You have me, who is attending to you during the donation process. You have the bag that I'm going to use to carry your blood. You definitely know that will be that will go to waste. Now you have me taking all the time to go to immunology for screening. You have someone there who will do the testing. You have the reagents. You have the machine. We have a lot of people. You have human personnel that will be included during the whole process, and everything would have gone to waste. So that's a loss. So I don't know how to better handle that, so that it will be captured in very, very early stages, whereby everyone will be safe. Now, me on my part will be safe, because I will not have I would not have risked myself during the whole process. Attending to patient is also a risk because you can also get the infection. You can have an accident in the hospital. It is thing. Also, I will be able to save all the materials that I might have wasted during the whole process. Is there a way I can be able to like save that and also save the patient by keeping them in a very well organized position? I don't know. I have no idea. So this is what I was thinking. Because we usually have several rooms during the donation, maybe I can just take that person to one of the rooms, because sometimes when you're doing blood donation, we usually have like an open space. We have beds, and then we have people are donating, each occupying a certain bed. Can we have like maybe they're partitioned and you're just donating your blood privately somewhere? If you're not donating, you're just staying there, just having fun with yourself there. And then after maybe a certain period of time, then you just go out and you rejoin your family members. I don't know. I'm just thinking that maybe we should provide a space for them, because they took part also in mobilizing people. So I don't know. I have no idea. So maybe you can tell me in the comment region, how can we better handle this? Because yeah, they are all members of the society. We don't want to risk. We don't want to go at a loss. We don't want to misuse a human resource. We don't want to misuse anything. So just tell me in the comment region the best way we can be able to approach this. This is open to everyone. In case maybe you are a health provider and you have an idea, I really would want to hear that. Again, if you are a patient and maybe you also have an idea of how I can be able to handle you better, you can just tell me. Hit me in the comment region.